Okay, well she moves, but she doesn't bend good. But you want to put them in what we call the frog position. Knees up and just let them go to the side. And when I'm doing it, I'm usually on her right side because I'm right-handed. You're left-handed, you probably want to be on the other side. It's just easier for you. She's got a boo-boo, I see. And I sometimes will lean on them as I'm doing it because I'm actually holding this leg here. So just so FYI. Okay, first thing I'm going to do, the first thing that your instructions tell you to do is to clean the perineum. Now, one of the biggest reasons that I clean it, sometimes there's not time to clean it. In the perfect world, we want to clean it. Obviously, it causes less infection, less microorganisms. The reason I'm going to do it, though, is because I'm going to tell her I'm going to clean your perineum, I'm going to get a washcloth, I'm going to find the meatus. Because I don't want to have to go searching for it when I'm sterile and I'm down there ready to insert. So I'm going to find it because anatomically it should be where it's supposed to be according to your pictures, but it isn't always, depending on age, how many children they've had, just whatever's gone on down there, and lots of stuff does, it may not be in the right, not necessarily the right place, but in the most obvious place. Okay, so you have to kind of look for it. When you find it, sometimes there's several little areas that you think, I think that's it. It's not going to open up and go, here I am. So if you stroke it from top to bottom, sometimes we call it a wink. It's actually a little spasm. It's just a reflex, I guess, of the opening, the meatal opening. It just kind of will do something, but you have to kind of really watch for it. Make sure you have good lighting too, that helps. Bring the bed up to this level because, you know, especially if you're doing a straight cath and you have to wait for the urine to empty, it can take a while and you can get tired. If you're doing a straight cath and you're waiting, because you're going to use the same type setup, it's just going to look a little different now. Make sure you don't let out more than 1,000 cc's at one time. Reason being, females, anybody really that's getting more than 1,000 out, that's a lot of output, and it can cause bladder spasms. And it can also, just because the body's losing that fluid, it can make the patient feel very sick. So go easy. You know, sometimes you get a lot if they're holding back urine, they can't pee, they've just had a baby, and they're swollen, they can't pee, which I couldn't, and they got 1,500 out of me, and I felt like I was having worse cramps than when I was having my baby. So it hurts. All right, so we're going to catheterize this lady. So we're going to explain the procedure. We're going to wash our hands, explain the procedure, make sure that she is who she's supposed to be, check the doctor's order, make sure there's an order, all that preliminary stuff. You're going to clean her and find where the meatus is. And then you're going to, after you've explained it, you've got her in position, and I would keep her head down, her head's up a little bit. The reason being, whoop, that's wrong. The reason being that depending on where your torso is, it's going to make that meatus go down into the bed. You want it up where you can visualize it. Does that make sense? Oh, that's as low as it goes? Okay. Well, also put the knees down because same thing. You want the bed as flat as possible when you're doing this procedure. Okay, so when you're opening your kit, you've taken it. Oh, you lost that. That's a very important piece. We need to put that on there. Stubborn. All right. Are y'all doing check off right now?
Monday.
Oh, Monday. Okay, so you're just practicing. So y'all are in class right now, or are you here just on your own? Oh, okay, that's cool. Your whole class here today?
Not everybody, but some of us.
Okay. Yeah. All right, very good. Interesting. All right, so the first thing you're going to do is you're going to open it. You're going to lean and open it so that you're not reaching over. This one, and this one. Now, anything that is down below the level of this tray top, you cannot bring back into the field. That should make sense, but sometimes it doesn't. So what I can do, if I need more room, I can pull it this way, but that's it. That's the only thing I can do with it. Okay, so the first thing we're going to do is we're going to grab this, and I don't have any gloves on at this point. You could wear gloves if you wanted to. I don't recommend it. Okay, the shiny side is the side that catches the water, so that's going to go down. So what I'm going to do is I'm going to go in this way, so I'm not reaching over. I'm going to ask her to raise her hips, and if she can't, then I'm just going to get this as close as I can, like so. If she can't move her legs. And remember, this is a mannequin, so she's...
The shiny side goes down?
The shiny side goes down, yes, because it's the water-resistant part. So it goes down so the water will leak down through and protect the bed. I strongly suggest that you put some kind of a Chuck's pad underneath your patient because that does not necessarily hold everything. The last thing you want to do is be in here forever to change a bed. I don't think they're using betadine so much anymore, so the liquid that probably is in here is going to be clear, so it's not going to be a big problem, but with the betadine it was a huge problem because that's really nasty stuff. This is the
so no gloves, and you can put that in there.
yeah,
That's
you
not
put that in
sterile?
without gloves. If I were going to use gloves, I'm not going to use this for a female, okay? It just creates shadows and all. This is more for a male, okay? If I had on gloves, I would then take this, actually I would do it this way, and turn it in like that so that my hands are covered to put it under. Okay, and then I'm sterile because I've got on gloves, so I'm not contaminating anything. With that pad, I would do it. Put it under like that. But that is not my preference, but you can do that. That will not hurt. So this is just off to the side. I don't need it. And gloves, you're going to put them off to the side. I may pull this down just so I have room to now open my gloves diagonally like this. Put them on. I'm gonna put them on, I guess. Looks like that's this hand. Make sure when you put your gloves on that you keep your hands above your waist. Don't do that. Alrighty. Now what I'm going to do is I'm going to move this around, this around. I'm going to go ahead and I don't think you're testing the balloon anymore, right?
We did.
No.
Okay, you don't test it.
They made me do it.
They
I think
did?
it depends who it is.
Okay, well some
with
it's
Mr. Millen,
very,
Yeah.
it's kind of controversial, but if you've got to test it, if the policy says test it, then go ahead and do that first thing, because if it's not a good one, you got to start over anyway.
Could you always ask your evaluator what's the policy on this?
I would test the
I would
balloon
just
for
test it
policy.
and ask later if I was getting evaluated. This needs more water in it, but it's okay for this demonstration.
That's why my
Okay,
box is
so,
wet.
and if you're going to test it, then leave it on. That doesn't seem like it wants to stay, but maybe it will. Alright, so then what you're going to do, open this up. If it's swab sticks, and go ahead and put them on your tray. Okay, and then toss that to the side or into the trash. The lube, again, you're going to open that up. You're going to, if it's a woman, just a big blob will do you. If it's a man, you're going to have to really probably put it down here where there's more space because you're going to lube up the whole thing. This is, this part in your kit is for you to collect a sample. If you need a CNS or something like that, then that's what that's for. And it's in every kit. Most of the time you don't use it. I don't know, it might make a nice little something to water plants or something if you put a hole in it. I don't know. Alright, so then what you're going to do, I would just go ahead and take this, I'd pick it up inside, come over here and set it down like right there. Okay? And I would, what am I doing now? I haven't done this in a long time. I'm like, what am I doing here? Okay, so I've got my lube and I'm trying to imagine everything that's in there. Okay, huh?
Would you clean now at this point?
Not yet. What I'm going to do now is I'm going to take this box. I'm going to go ahead and take this out. When you do it, keep it in the box so that it doesn't get contaminated. Do you know what I'm saying? Okay. Pick this up like it's a cigarette. Hold it inside like this. And let's see. I think I'm going to move this in a little bit. Drop this right here. It's not on my sterile field. It's perfectly okay because that is sterile. Okay. Now what I can do is I can put it in the goop and it should stay there, like so. Okay. Now I'm going to clean. I'm going to tell my patient that I'm going to touch you. I'm going to clean your perineum off. It might feel a little cold to you. What I'd like for you to do is just take slow, deep breaths just to relax. And this is not a painful procedure, but you might feel a little pressure as I begin it. So here we go. So we're going to open her up. We're going to go in with closed hands inside the labium minora and open her up. You can't do it on the mannequin here. I've not even seen this one. Then you're going to take your stick, which I'm imagining I have one. You're going to go from top to bottom, one side, and discard. Other side, discard. Straight down the middle, discard. Okay, then you're going to pick this up. It's got a lot of lube, and you're going to tell her, I want you to take a deep breath. While she's taking that deep breath, which relaxes her, we're going to go ahead and advance this. If you need to pull it closer, just pull it over like so. Put it in without your fingers touching, and this is obviously not going to go in, without your fingers touching her perineum, because you're going to continue to put it in, and you don't want to contaminate your fingers and then touch the catheter where it's going to go into her body, because obviously a greater chance of infection. Once you get it in, take your dirty hand then and hold it about an inch out, because she should not feel when you blow up the balloon. So you're going to blow this up, and you're going to kind of watch her face and tell me if you feel any pain or discomfort when I blow up the balloon that's going to hold it in the base of your bladder. So hopefully she won't see any. When I'm done, I can then let go here, take this apart, and I'm going to, just in case I shoved it in a little bit further than I needed to, I'm going to pull it gently and get that bulb to the base of the bladder. And then the procedure's done as far as your sterility goes. So you just have to remember then to put this under her leg, hang it on a place on the bed that's where there's no movement on the base, not on the side rails. Go ahead and note how much is in it, drain it, and record it so it's empty, and you know how much you got when you did the procedure, and then what's going to come out beyond that. Okay? Any questions?
Before you inflate the balloon, you would wait to see the urine come out first, right? And then.
Yes. Okay. Yeah. Let me clarify that. Okay, because this is really important. If this lady is numb from the waist down from an epidural, let's say, and you're having a catheter, like she's in labor, and she's, they're thinking 30 minutes or so she's going to have a baby. When you catheterize her, she's not going to be able to feel anything. You need to make certain that that catheter's in the bladder. So once you see urine, and it's going to happen very quickly, and if there's any urine in her urethra, God forbid, you're going to see a little bit then. But you got to make sure you go another inch or two, and I go 2 inches. You can't go too far, but you can go not far enough. And if you blow that up and she can't feel it inside her urethra, it'll cause her urethra perhaps to explode. Wow. And you know what that means? That means plastic surgery and heaven knows what. It means you're going to get sued. It means she's probably going to be peeing out her abdomen for a while because she can no longer get it outside this way. So it's very important that you get this all the way in, okay, before you blow it up.
But when you go to fill the balloon, if it's in the urethra, you'd probably feel that tension or the pressure.
You should. I would say you